Mr. Speaker, one thing is becoming very clear in the province of New Brunswick, and that is that many New Brunswickers can't get health care in either official language. And it's probably because of the fact that successive governments have put language over life when it relates to medical needs and medical care. Mr. Speaker, I'm getting more and more phone calls and emails from frustrated patients who are waiting for surgery. And while the medical term for some of these procedures are defined as elective, that term can often give a false sense of impression for the medical issue at hand. While the diagnosis of the problem may not be life-threatening, thus is defined as elective, that can change if the problem persists for months on end with no intervention. My question is for the Minister of Health. Can the Minister tell us how the pandemic has worsened an already large backlog of surgeries and where that backlog is today?
Minister of Health.
I appreciate the question, Mr. Speaker, because I think it is important, and those who have to wait for surgery certainly have a disadvantage with their quality of life. And so we understand that and we know that. And you know, despite COVID-19 over this past year, we've actually been able to the overall wait list for hip and knee surgeries has decreased by 9% from September 2020 to January 2021. We know that going to red phases and certainly having challenges with our ICUs, depending on the zones and what recovery they are of COVID, that has an effect on elective surgeries, and it is indeed something that we have been working with. I want to talk about a very special initiative that has happened with the surgical teams who are actually working together to book surgeries. And it is working so well. It's not a top-down approach. Again, it's working with the medical professionals in community, and they are doing a tremendous job at helping us prioritize and ensure that people who are waiting the longest are getting their surgeries. Thank you, Mr. Speaker.